Okay, welcome everybody. So good to see everybody. I am getting better at Zoom, so hopefully this one will go a little more smoothly than the last. I am so excited. This day is finally here. I've been looking forward to this one for a really long time now, and just excited that we can kick everything off here. Just a few housekeeping items. Looks like everybody's in compliance, but if you can double check and just make sure your lines are muted, that will help everybody's audio quality and move all of this along. If you have questions you would like to ask during the presentation, please use the chat function there, and I think it's usually at the bottom, or depending on wherever your function bar is. We will use that. I will pull from those towards the end of the presentation, and we can use that for the conversation with Pete to have a nice moderated conversation. This is being recorded, so if you are interested, we will forward the link to you after the program, and it will also be posted on the Business Development Forum website. So we will make that accessible to everybody for future reference. I expect there's going to be lots of good stuff here, so lots of good information and things you might want to reference going forward. For Pete, just a couple of comments, just so you know who your audience is. We have 3 groups that are with us today. This is a mix of the IHIF Board of Directors and members of that group, members of our newly formed Business Development Forum, which are folks that have an interest in growing Indiana's life sciences economy. And it's a lot of economic development folks, tech transfer office representatives, and then we have a couple of other invited guests in the mix as well. So good folks, and I think you'll find us a very interested and eager audience. So with that, I am going to introduce my dear friend, Pete Pellerito. And Pete has an amazing breadth and depth of experience that is going to be impossible to ever replicate anywhere. And while I know it well, I'm going to run through his bio really, really quickly here because
short, please.
because it is well worth the read to understand where he's coming from. He is also a good Midwesterner, so we are lucky to have his inclusion in that crowd here. So Pete Pellerito is the Senior Policy Advisor in the Executive Office of the Biotechnology Innovation Organization, our dear friends at BIO, in Washington, D.C., and he is a lead advisor for federal and state economic development and innovation policy creation and advocacy efforts in areas that include company creation, expansion, innovation partnerships, workforce development, and tech transfer. So he is basically in charge of absolutely everything that has anything to do with economic development, industry engagement with academia, and really anything that where there is an interface between industry and other outside groups. So he is the key point person for all of that. He has a background in higher ed administration at the University of Michigan. Sorry, Tony and other IU folks out there, go IU. Ann Arbor, and it has industry experience at Shaman Pharmaceuticals and Genentech in the good old days in South San Francisco, California. Pete has the responsibility of identifying ways that the biotechnology industry can successfully work with life science research centers, public officials, and other primary stakeholders in focusing on the next generation of products and services for patients. He serves on a huge number of committees, interfaces particularly with Autumn, because I know we have several folks in the tech transfer office. He is here. He has a bachelor's degree from California State University, Northridge, and a master's degree from Michigan State, where I know he has spent a good deal of time. So with that, I am going to turn everything over to Pete and let him take the lead. I am going to control the slides, correct, Pete?
Yes, you are.
Okay, let me call those up, and we will let you get going here. Oops.
So thanks. Hopefully, I know that Kristen yesterday sent the, there we go. I know that Kristen yesterday sent to you the Indiana profile from our 2020 report, and some of that will be ingrained into this discussion as affirmation and review, but some of it will of course be hopefully more new detail. So this is my 7th, and I'm very happy to be here. And so much appreciate the opportunity to be actually talking and listening to a whole variety of communities that over the years we have been able to make aware of what our industry is and how we and partnerships can work together. This is actually my 7th talk in 3 weeks. One of the interesting things about Zoom is I don't have to get in an airplane to go any place to do these kinds of talks. And while this is a very challenging time for all of us, I think it does provide the opportunity to be able to have conversations that are not encumbered by air travel and schedules. And also the continuing interest around the country in big cities, big states, and small states and smaller communities about trying to figure out how to be involved in our aspirational industry, but also the various components that we use for food and drugs and medical devices and all things related to the environment. So I'm very happy to be here. And the other aspect before I get into this is I'm glad to be able to speak to you as Kristen's colleagues, because ultimately whatever I say and do today is only a general overview. You are the ones who are actually making things happen in the great state of Indiana. So ultimately the value is for you to be together and discuss your collective aspirations, both in what I consider the 3 leadership areas for growth in our industry. Obviously, great academic research leadership, great public understanding, not only at a state level, but also at a local level of the value of the industry. And of course, an active industry itself who actually want to move their research and development effort forward, but also understand that they have partners in those locations that can help drive whatever research or manufacturing interests that they have. So let me start it out. So yes, I'm very happy to be here, and I was here, I think 3 or 4 years ago, or I was with you 3 or 4 years ago in Indianapolis as part of an earlier panel to talk about our industry in the U.S. and then identify some ways that Indiana could work together. Was it 3 or 4 years ago?
It was actually just over a year ago.
Oh, no. Well, then this would be the other one.
Only one.
No. Okay. Well, it seems to me that for some reason or other it's longer, but regardless, Indiana is a very important state to our efforts, as are obviously a whole variety of other communities out there. And the information I'm going to share with you is really in part an overview of our national report, again, that we put out in June. And for your information, if you would like to see the actual big report, you can go on to bio.org/jobs for the complete report. The report, which is, I'm a contributing editor, and of course, most of the work is being done, as we have done in the last 8 versions of it, with Economy Partners of Columbus, Ohio. Our industry is a real 30,000-foot overview works because of some very important components. People, ideas, infrastructure, funding, and supportive business climate. And hopefully what I will be able to highlight to you for the next 15 minutes or so are some of the aspects that you absolutely have in Indiana that you can enhance, and in areas where you need to identify ways to improve, that being the opportunity to do that. as I said, the reference point is 9 years ago, or 9 issues ago. We started this in 2004. At that point in time, our industry was fairly small. When you think about companies like Genentech and Amgen in the biology side, Biogen, et cetera, most of them did not even have a product on the market yet. Today, they are on the biology side very large and successful, internationally known and internationally distributed products that they create. Of course, Lilly, Eli Lilly, of which my wife was an employee for a goodly number of years in Indianapolis, is obviously is a worldwide leader in the pharmaceutical industry, and great kudos to the state of Indiana and to Lilly to be such strong, strident, strong partners with us generally, and certainly with as growing presence with our biotech side to move our industry forward. So if I could have the next slide. So what we try to do is understand what is our sector. There is no official, for example, there is no official designation within the Bureau of Labor Statistic of biotechnology. So over the years, we have identified it as a diverse group of sectors, including, of course, ag feedstocks, industrial biotech, sciences, drugs and pharmaceuticals, important component medical devices, although we do not represent the medical device industry per se. It is, of course, as we see more and more, an additive to the conversations that we have in terms of delivery of drugs and therapeutics to patients. So we keep them in our cohort. The fourth is research, testing, and medical laboratories. So obviously that pretty much is what it says, and it includes some of our biotech companies and some of our other related companies who don't have a product on the market. And the federal government says, well, if you don't have a product, you're research, testing, and medical laboratories. All very important adjunct aspects of what we need to do. The last area, we have added bioscience related distribution. And I'll talk about this here. I'll talk a little bit more about this in a couple of minutes, but it is so apparent to me and to us at Bio that Indiana is absolutely in a very important part of this, of our industry, because you are literally, as your motto says, the crossroads of America, and the ability to move drugs and pharmaceutical, agricultural products, et cetera, to all parts of the country and into Canada certainly is certainly an incentive and a good signal to us that Indiana is a great place to do bioscience related distribution. Next slide. So the industry is we're actually in a pretty strong position, even though we are in the global pandemic. I get questions about the current downturn and whether our sector is feeling the crunch of unemployment. And the answer is yes. But once the economy reopens, we think that our industry will serve as an economic stabilizer once the demand for medical treatments is in place and generally not dependent upon economic conditions. We did some work here in the last month and a half, and looking at charts that talk about past recessions, and certainly the pandemic being unique. But as a reference point, during and just after the Great Recession of late 2007 through mid 2009, overall US private employment declined 6.9%, compared with a decline of just 1.4% of the biosciences. And if you go back earlier than that to 2001, our industry is actually, all industry employment fell by 2%, while the bioscience industry actually rose. So we are, in fact, an important part of the broad economy, and during recessions, we have been able to be a consistent and stalwart economic component of our technology sector. Next slide, please. And as you can tell, our industry has grown in size and technology development. So has the geographic footprint. Every state has some facet of our industry sector within their borders. And actually 41 of the 50 states grew their employment from 2016 to 2018, including Indiana. And 217 out of 384 metro districts have a specialized subsector of our industry and continue to grow at a growing number of bioclusters in local, and I want to stress the word local, geography throughout the nation. And I can report that Indiana is number 6 nationally in large and specialized rankings in a cohort that actually includes California, New Jersey, North Carolina, Illinois, and the great state of Pennsylvania. So congratulations to you all for that accomplishment. As you know, these are very large states, but your industry presence per population clearly is noteworthy. Next slide, please. Did I lose you? Kristen?
Working on it.
Oh, I'm sorry. No,
Yeah.
We're good. Yeah.
Am I in the right place?
Next one.
It didn't. No, give me a second here.
Technology.
Oh, there we go.
Technology. So at last count, the nation's bioscience industry employed 1.87 million people across more than 101,000 business establishments, and as I mentioned, is well distributed around the country. Since 2016, the industry has grown its employment base by 7.2% or more, which is actually twice the growth rate of the overall private economy. All 5 of the industry's major subsectors that I mentioned previously grew their unemployment base since 2016, and the bioscience industry wages reached nearly twice the time of the average U.S. And really that number is $107,000 on average per employee nationally, $50,000 more than the nation's overall private sector. And add all this up, and our industry's total economic impact as measured by overall output totaled $2.6 trillion in 2018. And jobs created, if you're a public official on the call, or you work with other officials, it is important to realize that actually our industry created over $700 billion in wages and benefits nationally, and added $147 billion to state and federal tax revenues. Next slide. So I want to stop for a second and say, normally I think when people hear of the word biotechnology or pharmaceuticals, they think of just basically large companies. That is in part true, but a major segment of research, innovation, and economic activity is also occurring in smaller and mid-sized firms that are much less recognized. 71% of our industry innovation pipeline are smaller and mid-sized firms that account for a significant majority of our industry population and employment. 76% of therapies within the clinical pipeline reside within smaller companies, either led or partnered in research programs with, of course, larger firms. And over the past 3 years, from 2017 to 2019, last year, smaller firms accounted for 60% or more of all FDA drug approvals each of those years. So I think it just reaffirms that while, you know, Cook Medical and why Eli Lilly are very, very important, and Novartis are very, very important to your state's economy, there's a whole other community out there that are smaller that are also contributing in in ways that help your overall economy and creation of jobs and quality of life for your communities. Next slide. So I know you're aware of this generally, but two factors which have made our sector grow in vital early stage patent and creation communities and venture capital investments are important for early stage of company development for our industry nationally. The U.S. is, of course, the leader in both patent creation and risk capital with 100,000 patents plus and $100 billion invested in early stage companies in 2016 2019 framework. That said, there continues to be challenges to the viability of the patent system, whether it's patent trolls, pirating, and now the use of the pandemic as a rationale to alter the importance of major legislation that's always in place, focused on the innovation at the crossroads of drug and drug development. Okay, next please. Okay, so that's a national picture. From the profile that you have, I want to go over some of the highlights of that as to the work and efforts and the partnerships happening in Indiana. As you are certainly aware, your state has all the tools and for sustained success in our industry with generally supportive legislation, definitely a trained workforce, clearly a world-class research community, manufacturing expertise, transportation systems, and a growing entrepreneurial expertise. These are all ingredients needed to create products ultimately, either currently or in the future, for the marketplace. And again, I keep emphasizing not only to help the state as a general community, but also to your counties and cities and even townships in the locations where our companies are conducting business. So let's start this out if we can. Thank you. Next. Now, what I've tried to do is put this in this chart in place, and it looks like it doesn't work, but you have the profile in front of you. So let me just generally highlight what this very confusing in some respects and blurred chart says. It says that the number of employees in the bioscience industry in Indiana was 59,000 people, according to the Bureau of Labor Statistics data in 2018, the latest dates that we could get that kind of national information. They work at 2,185 establishments. The average salaries paid to Indiana employees is $101,000 per year, 52% higher than your state's total private sector, and $5.6 billion in annual wages. Medical devices and drugs and pharmaceuticals lead the way in jobs numbers, and drugs and pharmaceuticals and bioscience distribution are at the front of the line in average salaries. And you have several world-class industry leaders in your state, as I mentioned, Lilly, Cook Medical, Catalent, and Novartis being among them. In fact, when we look at the head of the class examples, you certainly can be proud that they are in your midst. They're not only producing quality products for the patient, they're also providing a place, for example, to college graduates in our sector and providing opportunities to expand their career horizons. So while that's a very unfocused per se slide, it does represent a substantial value, economic value, that our industry presents to the people of the state of Indiana. Next chart. So we're going to dive a little bit deeper into some of the research efforts in Indiana. And as you know, inventing and successfully commercializing a product, for example, is a uniquely challenging endeavor for those of you on the call who are within our industry, with basic and applied research being the foundation of long-term product development cycle that can take for a biopharmaceutical or chemically based pharmaceutical, 10 to 12 years and more than $2 billion for that product. And as typical in leading states like Indiana, academic research centers are at the formative stage of this exciting but time-consuming effort. As you can see from this chart, just over the past 4 years, the National Institutes of Health awards to Indiana research centers, both public and private, have grown to a total of over $1 billion. In that period, making Indiana one of the top tier states in this category. Here's a couple examples that I pulled out in some of my research to kind of illustrate the research success here. Purdue University produces more than $500 million in research funding in the fiscal year 2019, easily making it another record year for them. The $520 million generated, it marks the 5th consecutive year the university established record funding sources. The University of Notre Dame has received $180 million in research funding in fiscal 2019, and Indiana University led the way with $680 million in external relations in fiscal year 2019, representing more than 2,800 Indiana University research proposals. And there are certainly more, but I think those are typical of the kinds of efforts that your academic research communities are pursuing, and not only in terms of funding from the NIH and other public-private sources, but the research efforts the efforts that you're trying to actually make projects come into place that actually have ultimately some commercial applicability. Next chart, please. Patents. You know, the Bayh-Dole Act of 1980 gave colleges and universities rights to intellectual property generated from federal funding. Co-sponsored by your own Birch Bayh and Senator Birch Bayh and Senator Bob Dole of Kansas, the law was seen as a way to pull the United States out of an economic malaise in the 1970s. In the mid-2000s, I guess I should say, the colleges started programs and organizations to spur a research to market revolution, and Indiana has a high volume of patents with Hoosier inventors associated with 3,900 awards from 2016 to 2019 in bioscience-related technology classes. These are really some really wonderful numbers, and organizations like Purdue Foundry, Purdue Ventures, Innovate Indiana Fund, and Indiana University Ventures are in place today, as is the Idea Center and Innovation Park at University of Notre Dame. And again, collectively, the patents are the lifeblood of our industry. They certainly bode well for the kind of research going on, the patents created, and the availability to create companies and hopefully have them stay in the great state of Indiana. Next slide, please. One of the challenges for Indiana comes from the formation of I don't know whether it's probably at this point from 2018 to 2019, slowing in venture capital. But this is one of the few metrics that I actually know that you have as a priority for improvement. It's interesting to note that the one area of significant growth is the healthcare technology systems venture funding category. And also that equates to the convergence of technologies in combining IT, medical devices, therapeutics for patients and their care, both in hospital and outpatient environments. So next slide, please. I should have put here, I have in my notes here, it's not only Indiana accomplishments, which have been over the years many. I want to throw in the word recent Indiana accomplishments here in the last year or so. there's a lot of accomplishments by Indiana companies in our sector over the years, and I really want to just talk about three of them. The Purdue Technology Park and the radio pharmacy facility in cooperation with being done by Novartis. It's one of those efforts that's near the airports, the latest series of investments in plants by companies, and certainly Novartis, this being a perfect example. It's also the latest string of investments Novartis actually has been making in Indiana. So that's an accomplishment, and I'm sure you're all very proud of that. Catalent's partnership with AstraZeneca has led to several expansion projects in the Bloomington area, is driving more than a little of the cold chain distribution interest we've seen in central Indiana. This is an urgent matter, as transporting a COVID vaccine requires special cold storage distribution at more than minus 70 degrees Fahrenheit. That partnership is not only valuable here in the last several months, up to a year ago. In 2021, it will be clearly a high priority for conquering and COVID and providing necessary vaccines, et cetera. And just this week, the Food and Drug Administration issued emergency use authorization to Lilly for their monoclonal antibody therapy to treat mild to moderate coronavirus infections in adults and children. Three really spectacular examples and accomplishments recently that Indiana has had. Next one, please. So what I'd like to do is give you some what we consider some growth pillars. These are very, very important to our efforts, because infrastructure, as I said early on in the process, people, ideas, place, space, business climate are all very important, and infrastructure clearly being important. And, I'm asked the question most often, actually, around the nation recently, what are some of the key ingredients in creating the clusters? So let me start off with the infrastructure. Investments in basic and applied research facilities at universities and institutes is really an essential step in the innovation process, because the industry applications have dramatically changed in the past 10 years. State-of-the-art research demands modern research facilities. More specifically, state governments, academic research centers, and private developers are increasingly aware of this competitive advantage, if they have it, and have increased integrating the physical facilities into their long-term vision and strategy for economic development by providing physical space to leverage public-private partnerships and early-stage efforts. Now, so we know that Indiana's pursued several paths to provide this unique specialized facilities, obviously, and to meet the needs of what we need to be doing. Some of the other areas that I think in the infrastructure conversation in emerging sectors are, for example, artificial intelligence aided medical research, and specialty areas that include immuno-oncology research platforms. And again, very important to our infrastructure efforts, your efforts in Indiana, but certainly around the country. The next slide, thank you. The next is workforce. Like any knowledge-based industry, our companies need a strong supply of qualified and trained workers. To meet the demands, new curricula and programs all over the country are being developed by educational institutions working in close partnerships with our industry. While we have world-class researchers, regions, states and regions around the country need to have adequate management. So it's not just scientists. there needs to be supply management, sales, marketing, regulatory personnel who are knowledgeable and experienced in our industry. It's very important that we have those kinds of communities in place to help grow our industry. Next, please. Investment. So it's, this one is, of course, very important, obviously, like the rest of them, but it's I think it's in our collective, I say but it's certainly in our collective interest to strengthen existing statewide public and private programs for entrepreneurship companies for commercializing innovation and to realize opportunity in high growth emerging sectors. I think I'm going to defray from some of my prepared comments and say, if you're a Midwesterner like I am, and you come from an academic institution like the University of Michigan, there's always been this perception that everything in the Midwest is a flyover in terms of venture capital, for example. That most of the deal flow goes to the East Coast or the West Coast, and not much in between. And I think that is actually, in some respects, very true. But also, though, now I think there's an increased realization by state governments, regional economic development agencies, academic institutions to actually find ways to look at the resources that they have in terms of the research and try to correlate that to venture communities out there who really want to use their money to fund early stage research companies. It's one of the areas where I think Indiana, has done some interesting things, particularly as relates to the universities and the tech transfer conversations. And that's something that I hope you all continue to work on. The fourth and the next one is market development and attraction. As I said before, you clearly are a top life sciences cluster, and identifying gaps in the market and communication of ways to strengthen and your ability to fill gaps will further develop the state's leadership. I think one of the areas that really is important is to identify and capture opportunities for rapid growth at points of convergence between two or more sectors. As I mentioned, artificial intelligence and drugs, medical devices, and smart devices, other areas where medical devices and our technologies can be working together, and of course sculpting a market plan that actually brings together interested parties to identify ways to enhance not only what is in place, but also to look at some best practices from other parts of the country that can be implemented in your communities. Next slide. So I'm going to stop here pretty soon, but I just want to talk about some of the challenges for all of us in the U.S., certainly for everyone in Indiana, and they're basically four areas. COVID has a significant impact on employment. Nevertheless, our economy continues, of course, to be in a recession, and the state and local governments have been hit particularly hard. We now project that the state budget shortfalls expected from COVID's economic fallout will total a cumulative $555 billion over state fiscal years 2020 to 2022, where that affects a variety of positive economic development measures like workforce, R&D tax credit, net operating losses, and other fiscal support efforts will certainly give pause for bioscience companies thinking about maintaining their footprint in any state or region. The uncertainty factor is certainly with all of us. The second is the national discussion, obviously, of the cost of healthcare. There are several suggestions relieving the political pressure, including fostering industry-wide collaboration and commitments to eliminate copays and deductibles, setting launch prices that reflect innovation and value to patients, encouraging generic and biosimilars for approval, effective medicines once patent regulatory protections expire, and of course, as I said, investment in new novel therapies that meet unmet medical need. Clearly, this conversation has been going on now for several years. This will continue to be part of the national discourse. Third, of course, is private funding. And while the world's attention is focused on the hope of a breakthrough for COVID, the private biotech sector has racked up really, and kind of surprising to me, record-breaking investment during the first half of 2020. As much of the economy has fallen victim to the threat, venture capital funding for biotechs has not only weathered the storm, but topped over $6.4 billion in the first 6 months of 2020. The last is we have a new president and Congress, and we have a president-elect. We have an outgoing administration, we believe, and we believe that the new administration's approach to technology and innovation policy appears to be engaging the government as an active partner along with the industry in setting national and technology growth agendas. As in part, as well as a tougher regulatory environment for many technologies, and certainly our those are 4 areas that we all will be challenged going forward. We have been resilient over the last 40 years that our industry has been, like, certainly for the chemistry side, the Lilly's and the Novartis, et cetera, for more than 100 years. Our goal as an organization, and as I know as yours is to create quality products for the marketplace, for patients, and to have an economic basis for quality of life for our communities where our industry is located. So I guess I'd want to stop at that part of it to say we're always happy to come to Indiana and talk about this important topic. You clearly have all of the tools, and you've been utilizing them to continue your success in our industry. And as Kristen knows, we will always be available to you to not only keep an eye on what you're doing, so to speak, and try to work with you through our companies, including Lilly, Novartis, et cetera, but also IHIF, who and Kristen, a very important conduit of information to us from you and us through IHIF back to you, back and forth. And very happy to take questions at this point in time to try to be helpful, not only today in the conversation, but as I said before, we had this, before we got into the presentation, ways that we continue to be partners with you, not only in state government, but regional government and economic development agencies going forward. So it's all yours.
Fantastic. Thank you, Pete. I think I saw a couple of questions pop up in the chat box here. So.
Oh, can I stop 1 sec? Can I give?
Please go right ahead.
All right. So we every 2 years we do a look at innovative efforts in states to support the growth of our industry. And we will be presenting our updated report in June of 2021. We're in the process right now of trying to understand some trends, literally some trends, and we've done some research and survey work here in the last month and a half. Let me just throw this out to the group for conversation purposes, or at the very least background. You know, we're finding that smaller metropolitan areas are gaining ground in our industry, in part because of lower cost of occupancy, academic resources. And again, academic resources can be like the great universities in Indiana, but also the community colleges, which provide really very important skilled trade opportunities for a company, employment opportunities to be able to do whatever they're doing. So smaller metropolitan areas are gaining ground, so to speak, in this conversation. It's important to know that we're learning and reaffirm that the proximity to academic innovation is really a driving force in clusters. And while we think of the big clusters, we're finding that that smaller clusters are being created at locations where not only you have a company in place, but you have other smaller institutions, other smaller state universities that have some specialty in their research platforms that actually provide the basic research, the applied research, the translational research effort that can help a company, if it's certainly in the research effort, move forward with what it's doing. The last one is our industry. While we focus on healthcare, our industry is pretty diverse, and it's probably going to get more diverse. Agriculture is a very important part of biotechnology. And we're finding also that states, there are some states and some governments and some governors and some federal legislators who are going to be putting more resource or more thought process and resources into both agricultural biotechnology and in the environment, our industrial biotechnology community. And last is the ability for partners who previously had not seen the value of cooperation in the non-traditional way, the labor unions, the farm community, and other sectors who see the value of our industry and ways that they can incorporate some of their activities into making sure that the environment for entrepreneurship, innovation, and job creation is in place. Those are four important ones that we're going to be fleshing out here in the next while, that I think I wanted to make sure that the group knows about that, because all four of them to some degree or another impact the great things you're doing in Indiana.
Absolutely. Well, thank you, Pete. We've got a couple questions. If you got a couple minutes left, we can run through a couple of those. The first one, and this will kind of tee into kind of a broader question here, I think. We are ranked number 6 in large specialized categories with other prominent states. Can you talk a little bit more about how those ranks are calculated?
Well, first of all, in the drugs and pharmaceuticals sector, the industry, again, the information that Economy Partners does for us comes from the Bureau of Labor Statistics out of the Commerce Department. And so they basically look at the categories of which the quote unquote bioscience or biotechnology sector is using those NAICS codes, those national codes. And the Indiana is 6th in terms of the number of jobs in drugs and pharmaceuticals in the country. Add to that specialized, so that's just the large number. Specialized is even more specific. Per population, Indiana is not as big as California. It's not as big as New Jersey. It's not as big as Pennsylvania. Per population, Indiana is in the top 6 as it relates to that category also. So not just the raw number, it's also the percentage of the numbers of jobs in comparison to the amount of people living in the state. So it's large and specialized.
Okay.
And should say that in creating that description, it's taken us 2 versions of the report to actually become much more confident in the numbers, and they are very credible. In part because the Bureau of Labor Statistics uses our definition, uses the economy definition of what our industry is. So after 9 versions of it, we're very confident these numbers that were given, the raw numbers were given, are also equated better to the quality and validity of the report.
Great. Yeah, that's them using your definition is huge.
It is, and it's taken us a while to do it, but
yeah. Given that we have the codes are generally not great for our industry, not very descriptive. what we can eke out of all of that, the fact that there's at least a conversation going on there is good to know. There's a second, just a point of information on that one. And could you also define the size, what your definition of small to mid-sized companies are? Is that the standard SBA?
Sure, absolutely.
Or is there something else there?
Absolutely. So it's 500 employees or less. And again, it's not our definition, it's the Bureau of Labor Statistics definition. Let me go on just, if I can, just for a couple more seconds on this. If I put on my, and I was never an economic developer, but if I put on my economic developer hat, I would say to colleagues, we've come to learn that economic development entities have become much more understanding of what our industry is in terms of the science and regulatory and manufacturing. But it's also important to understand that our company is really our companies are in 3 phases. One is small companies. Great universities create patents, create companies. These are called emerging companies. These are companies with maybe 100, up to maybe 100 employees or 150 employees. They are in they're preclinical. They don't have, they're in sponsored research, they're in translational research, but they are not in FDA testing. They're preclinical. The second area, the second phase of our industry is, in fact, testing. These are companies that actually are in FDA testing, phase 1, phase 2, phase 3, phase, etc. The third category is companies that make something. They're manufacturing. They have a product on the market. Each of those sectors, each of those 3 sectors has priorities in all 5 areas that I talked to you about: people, ideas, space, business climate, and all 5 of those areas. Each of these 3 segments in these 5 areas have special needs, and states and clusters that are successful understand those 3 areas and how those 5 pillars, so to speak, those 5 priority areas can be implemented. For example, and I hope I'm not overdoing this here, but when we talk about venture capital, well, emerging companies need venture capital. On the other hand, a manufacturing company doesn't, because it has cash flow. What do they all have in common? So that's the money part of it. Workforce. Well, all of those 3 sectors need a quality workforce. At an emerging company, you probably have more bachelor's, master's, and PhDs on your staff. If you're a testing company, you probably have not only that, but you now have some people who have technical skills that don't require a bachelor's, maybe even associate's degree. If you're manufacturing something, you need less of the PhDs. You need more of the people who can actually do filling and QA, QC, et cetera. So in the workforce, and understanding the differences in those 5 areas of what companies need is, I think, very important to the conversation. And we'd be happy to share that. And it is in our last report that we did in 2019, and happy to share that with the group if they'd like to know more about it. So anyway.
Yep. Thanks. We have, by the way, we have that report linked on the Business Development Forum website. So if you're interested in checking that out,
yeah.
That might be a lead into the a tee up for you. You also work on the other report you do every other year is the Best Practices in Economic Development report, which is absolutely critical for us to inform our legislators and policymakers on the factors that are critical for our industry. Can you just talk really briefly about that one? And then I think we have time for one more question. We got a great one here from the folks in Bloomington I want to get to.
So we do this report, and we look at, I think the word best practice is probably an overused term. We're going to be changing it, by the way. We're going to be calling innovative practices, because innovation seems to be the new catchword of the week. We do this to be able to show state government, well, actually to show the partnership. Again, the three-legged stool, so to speak, the research community, the public community, and the industry. To show all three of those communities what other communities are doing to support the growth of the industry. And in part, it's to talk about, what this state is doing in workforce, a group of states, what a group of states are doing in investment, what a group of states are doing in infrastructure or incubators, accelerators, et cetera. That's very good information, because there's not a lot of there's not a lot of inventing the wheel right now in a broad sense. There's a lot of really great examples out there where these partners have come together in various states or regions in a state, in a county, et cetera, to work together to pursue companies, to help create companies, to help companies grow, and then pursue companies. So that report is an effort to try to help a state government, regional governments, to understand what other places are doing, should they decide that they want to capture, so to speak, our industry and help it grow in their communities. We also, in that report, look at business climate, because while on one hand, public officialdom, and this is Pete talking now, while public officials love the idea of jobs in their communities, both, if you're a state legislator, House or Senate, or even a federal legislator, it's important to have jobs for people to be successful, for quality of life, for tax revenues, the whole conversation. Sometimes that gets muted or overlooked sometimes when they're talking about cuts in state budgets. And they're talking about, well, really, is a net operating loss or an R&D tax credit really that valuable? And constantly try to explain why it is. We do some charts that actually show in some of those categories what other states are doing. So we have again, like IHIF is one of our great associations in our national organization. And those organizations, if they don't have a checkoff, so to speak, in 5 or 6 categories that we highlight, that they can go to their community, like everybody on this Zoom call, and state government and others, to say, if you want our industry to survive in this state, we need these kinds of supportive business climate legislation efforts to support emerging, testing, and manufacturing companies. So we provide the charts to help illustrate what states are doing what in several important areas of legislation.
Great.
I hope that is useful as a general overview.
Of course. One last question, and then we'll let everybody go here. Our friends in Bloomington at the Bloomington Economic Development Corporation recently partnered with the City of Bloomington, Indiana University, and others in the community to apply for U.S. Economic Development Administration funds to build a tech hub.
Yep.
As they're looking around at other universities and best practices, and who would you say out there we should be looking to for successful commercialization in biotech?
Well,
who are
well, there are actually several. The North Carolina Biotechnology Center is a great resource as to what's going on in North Carolina. It's an old established entity, as Kristen knows. It's 30 years old, and it took them 10, 15 years to figure out what they were doing, but they're doing quite well now. That clearly is one. The second one, of course, I mean, I don't want to say that these big hubs, these big clusters are the only place it happens. But they had to start out someplace. They had to start at a certain point. So you have North Carolina, San Diego, the San Diego cluster, and the efforts there they're really quite good. It's usually organized again by this three-legged stool community. I would be happy to do a side call with those folks from Bloomington to talk about this in more detail. Happy to do it. I mean, there are 10 years ago, there were not a lot of places doing it. You had, Boston, you had San Francisco, you had kinda North Carolina, et cetera. Austin, Texas is a great example. They have come a long way in the last 4 or 5 years. I'd be happy to do a side call or a side Zoom with your colleagues there in Bloomington. I come out of higher ed. I come out of Ann Arbor for 20 years now in government affairs, but I certainly understand university communities. And as I said earlier, I mean, if you look at the early years of our industry, certainly on the biology side at this point in time, on the biology side, Biogen was Boston, Genentech was San Francisco, Amgen was Los Angeles. That was and continues to be the epicenter of the research and the translational effort. And more we're finding out, for example, that private enterprise builders are actually more interested now in locations like Bloomington, and they'll put in spec wet lab space or incubators or accelerators because they see the potential there. Plus, they know, and we know, that the National Institutes of Health, for example, are pouring a lot of money into the mix. And quality research is always attractive to our industry in sponsored research efforts. So it's a big picture, and it is evolving. Yeah, there's probably a lot more of them, but there's probably 4 or 5 that I'd be happy to get a little more detail.
Great. Well, thank you, Pete. It is always great to see you and hear what's going on in the world and catch up. We really appreciate your time today. Thank you to all of our audience members. Again, we will make sure that this video is the recording is sent out to each of you, and it will also be available on the BD Forum webpage on our website, IHIF.org. With that, I will thank you all. Have a great afternoon, and take care, everybody. We'll hope to see you soon. We'll have another BD Forum event coming up here in the next month or so, as soon as I remember what it is. So it's out my head. So have a great day. We'll see you later. Thank you all. Bye.
Thank you.